The Genuine Article. Discussion and commentary based on articles from Jack.
Hello, I'm Tony DeMaria, the editor of Jack, and one of the papers we've got in press deals with the very interesting topic of sudden death. And in this particular case, they've exploited the ability to have very complete records from the United States military in looking at sudden death in relatively young adult individuals. And I'm talking to Dr. Robert Eckart, and Rob is the director of the Cardiac Arrhythmia Service at Brooke Army Medical Center and the lead author of this publication. So, Rob, in looking back at the database, can you tell us a little bit about the study and what you found?
Certainly. Dr. DeMaria, thank you for having me here. The most significant finding in our study was the high incidence of sudden unexplained death in those individuals under 35 years of age. We found that this comprised the majority of deaths, which has not been as clearly identified in those studies of passive reporting. We also found a marked increased incidence of coronary disease as a cause of sudden death starting as young as 30 years of age, of being a significant risk.
So what, in this military population in which you were able to capture virtually 100% of the events, what was the rate of sudden death, and did it differ between men and women?
The overall incidence of sudden death in our patient population was around 6 per 100,000. For those individuals less than age 35, it was closer to 2 per 100,000, which is pretty similar to what we're seeing in more active reporting studies coming out of the NCAA. There was a significant difference between men and women, particularly over age 35, where men were about fourfold greater than women, recognizing that our median age for our population was 38 years of age. So still a very young population as a whole.
Sure, and as I recall, you were able to find some evidence of structural heart disease in about 80% of the cases, leaving you about 20% with unidentified sudden death. What do you speculate was the etiology in these patients?
Well, I think, though, that as you alluded to in the beginning, the difference was the age breakup, whereas the absence of an identifiable structural disease was 40% in those under age 35. So a marked difference between less than and greater than 35 years of age. In those without sudden death, I think we've got to be looking at molecular autopsies. One presumes that this is either due to ion channel diseases, primary arrhythmias, and we can't exclude the role of ultrastructural diseases, whether that be unidentified hypertrophic cardiomyopathy or connexin disorders as well, are all things that we're continuing to investigate.
So based upon this, have you considered doing electrocardiograms in inductees?
We continue to talk about it, but I think the biggest thing that it told us was that to simply rely on echocardiography for screening for reduction of sudden death in this age population is not going to be the most effective strategy. We are looking at the role of electrocardiography, as is the civilian population as a whole. We haven't yet clearly identified that role yet.
Yeah, one aspect of your paper that frightened me a little bit was the fact that many of the patients, in fact, the leading activity at the time of sudden death was recreational athletics. How do you interpret that?
Well, you're right, and about half of our cases were associated with exertion, half of our sudden deaths. The problem there comes down to the case ascertainment bias. The military population as a whole is responsible for maintaining a certain modicum of physical fitness beyond that which may be seen in the generalizable population. And so they're more likely to be doing those things associated with exertion. At the same time, we know that those cases of death due to atherosclerotic coronary artery disease, hypertrophic cardiomyopathy, and many primary arrhythmias are also increased by exertion. And so those are things that we are continuing to delve into.
Yeah, but you haven't stopped exercising yourself.
I still try to as frequently as I can, sir.
Yeah, so do I, and I perhaps will worry about it a smidgen more. Well, very, very interesting data, especially in regard to the value of imaging in preventing sudden death in a young age group. For Inside Jack, I'm Tony DeMaria.